So for this video, we're into part 3 of our passive accessory motion testing of the hip. And for this one, we're specifically going to be looking at lateral and inferior glide. Now, these can be done with your hands. I'll show you what that looks like. However, because of the direction of these forces, and because of the capsule and congruency of the hip, it works far more efficiently to use a mobilization belt. So we're going to set that to the side. We'll use that in just a moment. But let's talk about setup. For this, you can keep the belt on the patient the entire time. You just need to be mindful of the direction of force. Additionally, you need to be mindful of where the table is in relation to your body. So body mechanics plays a big role. So first and foremost, let's worry about setup. I need to bring the table up such that this individual's hip is about at my waistline or just below. So if I step in here, they're a little bit below me still, so I need to keep bringing the table up. That looks better. And then I need to have the individual slide towards me on the table. Make sure that you're approximating your body to theirs so that there's no issue of safety or fear that they may come off the table. From here, we're going to bend our reference limb up, and we're going to leave it in that position. Now, I prefer using a mobilization belt that looks like this. You can also use a gait belt or other forms of belts. If you choose to do that, though, make sure that you're using a towel or something else just to decrease the friction or the pressure between the belt and their skin. At this point, I ask the patient to place the belt as close as they can, kind of in the groin, hip region. Because, again, we're into more of a sensitive private region here, it's best to keep your hands out of the equation and allow the individual to place the belt there for you. So, I'll bring the belt in and I'll say, what I need you to do is take this pad and approximate it as far as you can, right there, perfect. And then you're going to wrap the belt around you. Now, where this best shows is kind of right around your bottom. And our patient is doing a great job actually keeping their hand in place such that the belt doesn't slide around while you're getting everything kind of cinched up and tightened. That's a helpful thing if they're able to do that. You want as much slack taken out of the belt as possible. And so as you tighten it up, just make sure that you're adjusting as necessary. Also, you'll note that I'm wearing a metal belt buckle. Be mindful that that could push into the patient's thigh or skin and be uncomfortable, as well as buttons or things along those lines. So just keep that in mind such that you're maintaining patient comfort throughout. At this point, the patient can then relax and you're ready to perform your assessment. Now, for a lateral glide, we can either leave the hip in this position or we can bring the hip to about 90 degrees of flexion. Both are acceptable. The benefit of bringing the hip to 90 degrees of flexion is that we can also add in a degree of internal or external rotation, which allows us just a little bit more information about what might be going on in the hip in terms of provocation or identifying that comparable sign. And so from here, all we need to do is we need to stabilize the knee and shift our force lateral. And so what that looks like is my feet are in a staggered stance position. I'm going to shift my weight back onto my back leg and provide that force right through the belt. I can either hold that statically or I can create a little bit of intermittent off and on pressure. Additionally, you can create a little bit of static pull and then you can take the individual into external rotation or internal rotation and then find out if it's better, worse, or no different in terms of signs and symptoms. Oftentimes, patients, specifically those who have some joint narrowing or may have an osteochondritis dissecans or some type of a loose body, will really appreciate this technique. And so this often will just turn into a treatment technique in and of itself while you're already in this position. And so you provide that off and on pressure, or you can statically hold this as well. All right? So our first one then is lateral glide. Now, we're still in a position where we can then move on to inferior glide. Now, recognize that to get all the way inferior, we're going to have to create a little bit more slack in the system. So bring the foot back down, have the patient come back and hold this here, and then loosen your belt. And with an inferior glide, to get all the way inferior is quite challenging, all right? And so even in best case scenarios, it's more of an inferior lateral glide, which is also okay. Now we're going to shift though the pad to a little bit of kind of the upper thigh, more an anterior orientation. And then from here, what's going to happen is while the patient kind of holds that belt in place, we're going to bring the thigh up, and we're going to shift like such. Now our force is going to be directed more inferior and probably a little bit lateral. In this position, we still want to be mindful of the position of the knee. We want to stabilize here, as well as ensuring that the belt is not compressing or pinching any soft tissue. So make sure you're communicating with your patient as well. At this point, my right leg is still in contact with the ground, and that's going to be how I shift my body weight, is with that leg. So if you need to adjust the table, make sure you take that into account. At this point, we're going to stabilize, and we're going to lean our body back as we inferior glide through that belt. Additionally, we can rock the hip into flexion as we inferior glide. That will increase the specificity of that glide, but it changes it from a passive accessory motion assessment to now a treatment technique known as mobilization with movement. So be mindful of how you utilize that and when you utilize that. So, from there you can unclip the belt and allow the patient to relax. The benefit of using a mobilization belt is it's a one-clip ordeal, whereas with a gait belt, you have to kind of untie it, so to speak, or take it out from the buckle. So it takes just a little bit longer process, a little bit more arduous. So with that, you have inferior glide, and you have lateral glide. Have a try with a peer or colleague, and let me know if there's any questions.